A 2-month-old boy has been experiencing irritability, poor feeding, frequent vomiting, hepatosplenomegaly, reduced muscle tone, and chorioretinal lesions in both eyes. He has enlarged ventricles and scattered intracranial calcifications observed in an MRI of the brain. The boy's weight is at the 15th percentile and head circumference is at the 96th percentile. What is the most likely cause of this patient's condition? This patient is presenting with signs of congenital toxoplasmosis infection. Toxoplasmosis is going to be one of the torch infections. So the T is going to be for toxoplasmosis, the O is for other infections, R is for rubella, C is for cytomegalovirus, and the H is for herpes simplex virus. Now, the patient has presented with the classic triad for a congenital toxo infection. A mnemonic that you can use to remember this triad is Chicago is toxic. So at one point, Chicago used to be a very violent city. So you can remember this mnemonic to help you with the triad that is going to be for congenital toxoplasmosis infection. So the C is for chorioretinitis. Here we're going to have yellow-white lesions on the retina due to chronic inflammation. The H is going to be for hydrocephalus, and the I is going to be for intracranial calcifications. So congenital infections are going to be passed to the baby in utero. And so the answer is going to be answer choice C. So this patient, as we said, is presenting with classic signs of congenital toxo-infection. Remember, the mnemonic Chicago is toxic, so the C was going to be for chorioretinitis. Here we see chorioretinal lesions in both eyes. The H was for hydrocephalus. We see that the head circumference was enlarged, which is a sign of hydrocephalus, as well as the frequent vomiting, which indicates an increase in intracranial pressure. And the I was for intracranial calcifications.